All right. So, as I said, I'm Chanel and we have Heather. This is an area that Heather definitely researches heavily. And I wanted to partner with her in something that was an important topic. And we landed on fostering the counseling relationship and supervision, implications for working with transgender clients. So what we're looking at is students who are actually engaging with clients who identify as transgender. And we wanted to see how we could support the supervisory relationship within that. So largely that's what we're going to be talking about today. Heather, did you have anything you wanted to add to that?
No.
All right. So our learning objectives for today, the first thing we wanted for you to understand common ethical dilemmas faced in counseling transgender populations. We also want you to increase your knowledge on how to address ethical concerns related to transgender clients and increase your competency overall in applying ethical decision-making that supports non-traditional gender identities.
Mm-hmm. So first and foremost, I wanted to address what does this term transgender mean? We've been hearing more and more about this as people are becoming more comfortable with their sexuality and their gender identity, and coming out as trans. And so I wanted to first identify what does this mean. And so it's an umbrella term that is used to describe people whose identity, their gender identity differs than their sex that was assigned at birth. So for example, a female assigned at birth who has decided and has figured out that that is not who they identify as, and they have decided to do this transition process and identify as male instead. So this refers to someone's internal and personal sense of self. It is a deeply personal decision when someone goes through this process. And I want to remind you all that when we use the word transgender, we're using it as an adjective, not a noun. So we're not describing a person as being a transgender, because that is not who they are. It's just a part of their persona and who they identify as. And so an example would be saying that Jamie is a transgender person, not Jamie is a transgender. We also don't want to use ed at the end of that either. So we're not wanting to say this person is transgendered. There's negative connotation with that. And then also being very mindful that gender identity is completely different from sexual orientation. Again, gender identity is who that person identifies as in a gender. So either non-binary, male or female, because it can be very fluid for some people, versus sexual orientation, which is who they are attracted to sexually. So why is this topic so important? And this is a topic that is very dear to my heart, working with the LGBTQ community in general. And as I've done a lot of research, there's been some things that have really stood out to me. And one of those is that there's high rates of negative experiences in therapy for LGBTQ individuals, and specifically with the trans community. And this is because of some of these missteps in care. So the first one is called education burdening, and this is kind of when the individual feels the need to educate the therapist on issues related to being transgender instead of the therapist educating themselves. And remember that we as counselors and we as clinicians in training, it's up to us to really go out and do a lot of the work and learn about different cultures and different backgrounds. And so burdening is when the client feels like it's their burden to tell you everything. Gender inflation is when the counselor overlooks other important aspects of a transgender client's life beyond their gender identity. So really inflating the identity and ignoring other parts of their identity. And then gender narrowing is the exact opposite of that. So this is applying one's own preconceived and restrictive notions of gender onto transgender clients. And so just you're really just narrowing them and kind of putting them into a box about what your notions or thoughts of being transgender mean. And then gender avoidance is exactly what it sounds like. I'm not talking about it. I don't like it, so I'm not going to talk about it. I'm just going to completely avoid it altogether. And you don't put any focus on the gender identity at all. Generalizing, also very straightforward. And what it sounds like is we're making assumptions that all transgender individuals are the same and applying generalizations to every transgender person that one meets. And so you're applying this like kind of universal narrative and not understanding that each transgender person that you meet is going to have a completely unique experience. Gender repairing is trying to fix the problem with the client. And so with that, it's you're conducting therapy in a way that the individual's gender is a problem and you're trying to change that person's gender or identity. And then gender pathologizing is you're treating them as it's like a mental illness. It's a pathological condition that needs treatment. And, keep in mind that this isn't the DSM-3 anymore. We've moved on from having, stuff like that in the DSM. So, we don't want to put any type of label on them. And then gatekeeping is the final one. And this is when clients approach us as counselors or clinicians and, maybe they need help with the transition process if they are deciding to do that and they need to do counseling first. And the gatekeeping aspect is like, we're just completely focused on completing the paperwork for medical procedures and letter writing responsibilities and not addressing any other issues that the client might have. So these are some of those really common missteps in care that might be seen that we have to be aware of and focus on.
Okay, so let's get into some ethical dilemmas that can occur when you have students who are counseling clients who identify as transgender. The first is, and these are not limited to, I want to say that as well. So these are just some that jump out immediately. The first is avoiding harm and imposing values. So of course, we are ethically called to not impose our own values, attitudes, beliefs, and behaviors onto our clients. We're supposed to respect the diversity of clients, trainees, and anyone that we are working with. So there's a risk when we impose our values onto clients, especially when the counselor's values are inconsistent with the client's goals or are discriminatory in nature. So we want to make sure in the supervisory relationship that we're monitoring our students as well as their values and how that might be coming out within the therapeutic process. We also want to acknowledge roles and relationships at individual, group, institutional, and societal levels. In regard to advocacy, when appropriate, counselors advocate at individual, group, institutional, and societal levels to address potential barriers and obstacles that inhibit access or the growth and development of clients. So here, what we're looking at is a need, a population that might require some advocacy. An example I will give is a client maybe who is seeing a student at a career counseling center or a college counseling center, right? It may be that counselor decides to hold groups because they acknowledge through the therapeutic process that there is a need for those groups. One, that student would need to get permission from that client as far as the advocacy that they plan on doing by hosting these groups. And then the advocacy process begins. So of course, consent is essential. I didn't list that code, but just recognizing the ways in which we might advocate for our client and if there is or isn't any consent needed. Termination and referral. You have some students who will find that, oh, well, I'm not competent in this area. I don't want to work with this client. And we want to make sure that we're doing that ethically. So competence within termination referral, counselors actually lack the competence to be a professional assistant to a client. They avoid entering or continuing counseling relationships. Counselors are knowledgeable about culturally and clinically appropriate referral sources and suggest these alternatives. If clients decline the suggested referrals, then counselors can discontinue the relationship. Now, with that being said, values within termination referral, counselors refrain from referring prospective current clients based solely on the client's personally held values, attitudes, and beliefs and behaviors. So this is a situation where a supervisee just doesn't want to work with them because they don't believe in how they identify. That is completely not appropriate. We would not be able to support that decision. That is something that they will have to work through. In addition, even when it comes to lacking the competence, it is important that supervisees seek the information, or rather the answers to the information that they seek prior to terminating or referring a client. And then there's abandonment and neglect. So we never want students to just completely stop seeing a client. If there is something that is happening within that dynamic and you notice maybe a student is not wanting to work with a client, you want to make sure that you're keeping in contact with the site supervisor and just having those lines of communication open just in case something were to occur where that student just decided, you know what, I'm not going to see this client anymore. So we just want to make sure that we're monitoring that. And then just being knowledgeable and compliant with standards, understanding that students are responsible for the ACA Code of Ethics, just like we are when they enter these master's programs, they are responsible for abiding by the Code of Ethics. And the last is just professional competence. So boundaries of competence, counselors practice only within the boundaries of their competence based on their education, training, supervised experience, state and national professional credentials, whereas multicultural counseling competency is required across all specialties. Counselors gain knowledge, personal awareness, sensitivity, dispositions, and skills pertinent to being a culturally competent counselor in working with a diverse client population, right? So students are called to do this work. We understand that there are boundaries of competence. However, when it comes to multicultural counseling, when it comes to gaining that knowledge, we are requiring our students to go out and seek the information that they need.
I wanted to include some important statistics in here so that you guys can kind of get an understanding of just what we're facing when we are working with transgender clients, and some of the prevalence rates of suicidal thoughts or mental health issues within this specific community. So the Trevor Project is a really wonderful resource for information regarding LGBTQ plus youth. So a lot of the information comes from their website and studies that they have researched. And I've included information on here for both youth and adults. So for those of you who work with youth and adolescent clients versus those of us who work with adults. So really quickly, I'll run through these. More than half of transgender youth have considered suicide. About 29% of transgender adults live in poverty, and these rates increase amongst persons of color. So as you can see, 39% with Black trans adults, 48% with Latino, and Alaska Native, Asian, Native American, and Native Hawaiian or Pacific Islander at 35%. So really high numbers for that population. 61% of transgender and non-binary youth report being prevented or discouraged from using the bathroom that corresponds to their identity. And 54% of transgender people have experienced forms of IPV or intimate partner violence, and 47% of those have been sexually assaulted in their lifetime. And then a couple more, half of transgender and non-binary youth did not receive mental health care that they wanted to receive because there were concerns that providers would not be competent or there would be a lack of care or barrier to care. So they did not seek out mental health care, or if they did, they were met with some of those barriers we mentioned earlier. So the gender narrowing, the education burdening, those kinds of things. About 40% reported being physically threatened or harmed because of their gender identity. And again, this number is when a person is a trans person of color, the number is about 32%. 2/3 of LGBTQ plus youth have stated that debates over state laws targeting transgender people negatively impacts their mental health. And currently this was in 2020, so this has changed a little bit since then, but as of that time of the report, there were about 100 anti-trans bills in the country. And these include bills on bathrooms, who's allowed to use what bathroom, whether transgender individuals are allowed to compete in sports, what type of benefits they have available to them, et cetera. So very important to see how societal messages have influenced the mental health of transgender people. And then lastly, 29% of trans people have reported being refused health care by a medical provider because of their actual or perceived gender identity.
Okay, so with those statistics in mind, in regard to our students and the supervisory relationship, we want to talk about the importance of fostering that relationship with your supervisees in order to support clients who identify as transgender. So one, supervision empowers the supervisee, right? So it equips them with the tools that they need in order, the tools and the processes that they need in order to best assist clients. Students are able to really get some of that noise outside of their head in the supervision relationship. So we want to create an environment in which that collaboration, which is a bullet point down, can happen between the supervisee and the supervisor. It also accomplishes growth and development. So we challenge our supervisees during those times. We push them to understand, to learn, to grow and stretch a bit more. It challenges biases. So these things pop up. You'll hear it in the dialogue that you're having with your supervisee. You'll see it in the approaches that they choose to use. You might hear it in the tapes, their case conceptualization. So when you're able to monitor student progress, you're going to see some of those biases pop up and what might need to be done. I've already talked about collaboration, develop efficacy in the therapist-client relationship. That was self-explanatory. Improving knowledge and working with marginalized populations, right? So as students do come in, and I typically tend to challenge any student that differs. And I challenge students to even recognize the ways in which someone who looks exactly like them differs from them. And the ways in which they may be marginalized. So just making sure that you're cognizant of the ways in which you can foster a healthy supervision relationship. And I believe that is one that allows the supervisee to stretch and grow. And even you as a supervisor, being able to stretch and grow within those constraints.
All right, so in my research with this, I found some really interesting information about perceptions and views of working with transgender populations. So the article from Kanamori and Cornelius White from 2017 found that women tend to have higher favorable views of transgender persons than men, and that personal familiarity over professional familiarity or working with clients actually tends to have a higher positive attitudes and competence with gender identity issues. And this is likely due to it's somebody that we know and care about and we love, and so we tend to have that sort of positive attachment already to that person, versus in a professional relationship that isn't necessarily present, at least not right away. Another really interesting fact from their specific research was that placement in a master's level program in counseling is not correlated with competence in gender identity issues. This is often due to the fact that we tend to talk about it in one class that is kind of an overarching diversity and multiculturalism theme. And so it's, maybe a 1 week topic and then you move on to something else. And so it doesn't get enough attention. And so because there's not a lot of attention placed on it, students are leaving not feeling super competent and working specifically with gender identity issues versus working with like someone who is lesbian or gay or bisexual. Which just shows that there's no correlation between coursework and attitudes towards transgender individuals, because we haven't talked about it enough, essentially. And professional experiences were actually found to correlate with negative attitudes for counselors in training, which goes to show, again, those personal connections are what really should be reinforced in order to improve attitudes towards clients. So, really immersing ourselves in the community and learning and more from the transgender community. And then quality over quantity of training should be the focus. You can take 10 different classes on diversity and multiculturalism, but if there's not good content and there's not good core quality there, you're really not getting much out of it. So it's really the quality. I'd rather take one really good course on transgender issues and populations versus 12 that just kind of gloss over it.
Okay. So you also want to talk a little bit about Brown's article. And one thing that was found was that microaggressions affect the therapeutic relationships. It's like a light bulb, right? We know that microaggressions impact the therapeutic alliance. So when students express disapproval or discomfort with transgender clients, that can be problematic. So this can come in verbal and nonverbal body language, pathologizing transgender identities. So as Heather talked about early, treating that client as if they have an illness is problematic. An invasion of bodily privacy. So asking invasive questions about their body, questions that you wouldn't ask anyone else. We want to encourage students to not do those things. Very few programs provide specific training on working with transgender populations. This was also found in the study, as similar to the study Heather just discussed. So just recognizing that there are going to be limitations. Counseling programs are not going to be able to cover every single issue or thing that we might see with clients. So just making sure as supervisors that we have different tools. So if there are trainings that you can refer your students to, that might be helpful, right? If you know that they are seeing a high amount of clients who identify as transgender, think about trainings that might be beneficial for them. In one study, only 40% of participants engaged in further training. So just recognizing that even though it's known that additional training is needed, counselors aren't necessarily going on and doing the additional work, okay? Majority of them are not. Transgender specific training was found to relate to more positive attitudes. Okay, so, one, increasing the counselor's confidence, going into those sessions, knowing that they have more knowledge, as well as the client's experience of that counselor, knowing that they have more specific training. Negative attitudes. So there are negative attitudes that exist when the therapist is conservative, male, heterosexual, religious or Caucasian, or a Caucasian mental health provider. So as a counselor, that means if you identify this way, in what way can I make my client more comfortable, right? How can I address my privilege in this room in order for my client to feel more empowered, right? That this is their session, that I'm not going to impose my views on them, knowing, right, that there are these negative attitudes there. Also, favorable attitudes exist when the therapist is female, ethnic or sexual minority, liberal, less religious mental health provider. So this may be attributed to the experiences of belonging to minority groups and empathic attitudes for transgender people's experiences. So as earlier, the research has said that clients who identify as transgender do prefer women who are female who are therapists. So just making sure that we're knowledgeable about these areas.
So we wanted to talk about some of the techniques and stuff that we would use to work with these clients. And one of them is utilizing the minority stress model. And what this is going to help you do as both either a supervisor or a counselor working with a transgender individual is recognizing the unique stressors that those who come from minority populations and marginalized populations are experiencing. So minority stress from Meyer's research in 2003 is identifying additional stress experienced by marginalized groups. And this is because of discrimination or stigma, prejudice, rejection, lack of support, or not having, and this could be, when I say support, it could be family, friends, or even community. You have to consider some of these small rural communities where, I live in a bigger city, so I have an LGBTQ life center here, but smaller towns in my state of Virginia are not going to have that. And even internalized stigma, internalized homophobia or negative thoughts towards the self due to pervasive messages from others and society that have caused negative thoughts. So the minority stress model is three things. It's unique, it's chronic, and it's socially based. And what this means is that in addition to having general stressors experienced by all people, there are very unique and specific stressors that LGBTQ people face. And again, these are those prejudice, discrimination, that kind of thing. And chronic means that there's underlying social and cultural structures that are perpetuated. And this could be, again, some of those social and political issues within the LGBTQ plus community. Again, we talked about how there's over 100 anti-trans bills throughout the country right now. So these are ongoing things that are constantly happening that are sending these negative messages to this community. And then socially based are the social processes, the institutions, and the structures beyond the individual's control that contribute to increased stress levels. It can be both distal and proximal, meaning distal are these objective events and conditions that are happening way outside of us. Again, anti-trans bills, societal messages. And then proximal are personal processes that the individual is going through. And so this could be, again, internalized stigma, perceptions and views of how they view themselves and the world around them. And so the three processes are external objective events, expectations of this event, and how vigilant one needs to be. So if the individual is going to a party, for instance, how out can they be? Is it safe for them to be in that environment? And then internalization, again, just internalizing negative values or attitudes towards themselves. And then on this next slide, this is the model itself that Meyer came up with in 2003. I'm not going to go through this whole thing. It's very, it's quite complex, but it's a really good model that you can see how the circumstances in the environment combined with minority status and minority identity contribute to not only general stressors, which is this middle column, but also those distal and proximal stress processes. So again, discrimination, victimization, concealment. Concealment is the idea or the process of how much of my identity do I need to conceal, or how much can that person reveal to other people, and how all of these then directly affect the mental and behavioral health outcomes of the individual. Now up here we have coping and social support. So obviously the more coping skills and the more social support and network they have, the more favorable the outcome could be. But if those things are not in place and all of these stressors are really just pushing in on our person, then we're going to have unfavorable outcomes.
Okay. Now, adding to our toolbox, we have affirmative therapy. So affirmative therapy is defined as a set of skills in clinical practice that are informed by a positive view of LGBTQ plus individuals and relationships and an awareness of the negative influences of heterosexism and homophobia on the well-being of LGBTQ plus individuals and relationships. So the first step in that is to understand key concepts related to working with LGBTQ plus clients. So this is essential, right? Supervisees need to develop conceptual knowledge about the constructs related to working with LGBTQ plus clients. In particular, therapists need to be knowledgeable about homophobia, heterosexism, heterosexual privilege, and minority stress. So when we're looking at homophobia, therapists may consciously or unconsciously hold homophobic beliefs, such as beliefs of the inability of LGBTQ plus couples to develop long-term monogamous relationships. This, in fact, will limit their ability to provide effective couple therapy, right, to those clients. So we want to make sure that students are aware, why is me understanding homophobia important? Why is me understanding heterosexism important? So this one, is defined as societal belief that is based on the assumption of the superiority of heterosexual identities and relationships with the inferiority of LGBTQ plus identities and relationships. Important term to know. The same with heterosexual privilege. So, examples of that may include privilege, including having one's sexual orientation affirmed at any mental health or medical center, being able to freely discuss one's relationship without fear of negative reprisal, and easily finding portrayals of one's sexual orientation in textbooks and in the media. Okay, so those concepts all work to help a supervisee understand and begin to better conceptualize the lived experiences of the clients that they're seeing. So one, that is extremely important, right? Making sure they understand those key concepts. The next is making sure they develop skills with affirmative stances. So being able to communicate effectively is extremely important, not using non-heteronormative language and directly exploring the influence of heterosexism on the lives of LGBTQ plus clients. An initial important step in that is being able to communicate an affirmative stance. And you won't do that unless you understand those key concepts, understand, in what ways is my office, right, inclusive? What images does the client see when they walk in here? So it's not just that verbal communication, but it's also that nonverbal communication. Is your paperwork inclusive, right? Are you asking about pronouns? How does your staff introduce, or rather, how do they introduce or dialogue with clients on the phone, right? Are they making assumptions about how they identify, right? Using pronouns like she or her when they maybe would prefer they instead of just using their first name. But it's those small things that allows the client to know whether you actually support and are going to affirm them or whether you're not. So we want to teach our supervisee skills in order to do that. And then the last thing is just really, and probably the most important thing, is that self-exploration. So just making sure our students are engaging in critical self-exploration that explores their heteronormative assumptions, biases, and privileges. We talked about that in the beginning as it relates to ethics. And it's something that students need to continue to do. So assumptions are automatic. They immediately pop up in our head, and sometimes they're unconscious. And it's really important that we explore that so we're able to bracket those experiences or those thoughts that we may be having in the counseling relationship in order to not negatively impact our clients or harm them. And I would also just add a note to make sure you encourage students not to ask clients a lot of questions. It's important that they do this work on their own. Our clients are not there to educate us on topics such as these. So that's why we come to sessions. We, get continued education to seek this information on our own. Support that growth and develop within the supervisory relationship. Another model that I find helpful, and some of you may be familiar with this model, but it's Bernard's discrimination process model. And it allows the supervisor to think about different roles that might be helpful for the student based on the supervision that they're needing. So I ascribe to this model, and it has 3 roles. So you can be teacher, right? So maybe your student is needing to be educated on process that relate to the client that they're seeing. Maybe they need a more process-oriented focus. So maybe you're going to operate in the counseling role. Maybe they need a consultant, right? So what are some things that I can do? What are some things that I can apply with this client? And the focus of supervision here is 3 skills. So intervention, conceptualization, and personalization skills. So the intervention skills are going to be those observable skills. So what can I see? What interventions and techniques does my supervisee have in their toolbox? Conceptualization skills, so occurrences in sessions, recognizes themes, selects appropriate interventions systematically. So just making sure that those conceptualization skills are being observed and you're able to hear and see from your supervisee how they're able to conceptualize your clients. And then last is personalization skills, so the ability to bring individualized approaches to counseling while maintaining counter-transparent, free therapeutic environment. So making sure our students heighten their awareness, right? So we talked about that self-reflection and self-exploration, and thinking about how these roles and these intervention skills will assist you in helping supervisees develop better skills to support trans clients. So some tips. The first thing we would suggest is that you dedicate or encourage students to dedicate time for research, and even ourselves, right? We're not all knowledgeable on anything at any given point. Knowledge is on a continuum. So we're continuing to gain better practices, better ways of being to support clients. So we all want to dedicate time for research and self-reflection outside of sessions. We want to affirm the experience of trans individuals within the context of their intersecting identities. So recognizing that clients are not just trans, right? That's not their whole identity. They're, identify as trans and are Black. They identify as trans and, are maybe from a low SES background. There are so many different things that are happening there that we don't want to reduce someone to one identity or one thing that they identify with. If you're not sure what a term means, don't ask, don't assume. Okay. It means ask, don't assume. And I would encourage you to first encourage students to ask you first, ask their supervisor first. If you are a student here, ask your supervisor first. You don't want to go to or rely too heavily on asking your clients something that you don't understand. Also use gender neutral and affirming language. And I think Heather's gonna finish these.
Yeah. So again, we want to take a systems approach, which is like Dr. Robinson was saying, looking at all of those different identities of the client and their intersectionalities and how all of these play off of each other. And also looking at like family systems, support systems, societal systems, and how these have impacted who they are now, and let them guide how much gender is the focus of treatment. We don't want to have those missteps in care like we talked about earlier. Be aware of those microaggressions. Body language is really important when working with these clients, and also, the bodily autonomy, asking them really personal questions about the transition process, and not being mindful of that. It can be very harmful to the relationship. Again, avoid a focus on transition. Not every transgender individual is going to transition. Again, it's a very deeply personal choice to do a transition and go through that process. It's financially a huge cost to bear, and emotionally. It's just a lot that goes into that. So we don't want to focus on that in the sessions with them. Apologize for mistakes. We're human. And if we're not used to working with this type of clientele or population, we're going to make mistakes. So just apologize and learn from it and go from there. Have inclusive practice logistics. We mentioned earlier having paperwork that includes gender identity on there, and not making assumptions about someone's identity when we're talking to them. Having those inclusive practices can be really helpful, even when introducing yourself to clients and saying, my name is Heather and I go by she, her pronouns. That can just be really affirming for the client. Like, wow, okay, this person is knowledgeable about this. Engage in your local LGBTQ community. so many things are online nowadays too. So if you do live in one of those rural areas where there's maybe not a lot of options, go online. Some of the resources that we have at the end of this will help you all find some of those resources. Go meet people who are part of this community, and then commit to that continued learning. Like we said earlier, less than 40% of students are going out and finding additional learning. So commit to that. Attending stuff like this or going to conferences and learning more about what it's like to work with this community.
Okay. So here are some of our resources. I'll talk about the first one. And this one is Gay Affirmative Therapy for the Straight Clinician, the Essential Guide by Joe Port. I selected this just because sometimes it's good to have not a text read, but a self-help read. And for those who identify as heterosexual and our clinicians, this is a great way or a great easy read about how to support clients who do identify as gay and you're looking to utilize affirmative therapy.
Mm-hmm. The other ones are ones that I included on here in my research. So again, the Trevor Project is a wonderful research or website for research on LGBTQ, like youth and adolescents, and they have a lot of wonderful resources. GLAD is another one. They have a great directory of different terms and phrases that one can use if you're just starting off working with this population on appropriate terms and how to understand them. Rainbow Health is another one of them, and that's where I got a lot of some of the statistics from. So if you want to know more about some of those stats, you can go there. The APA, or American Psychological Association, has guidelines for working with transgender and gender nonconforming people, another great resource. And then, of course, the ACA's division, which used to be called LGBT, the Association for LGBTQ. It's changed, the name has changed, and it's now the Society for Sexual, Affectional, Intersex, and Gender Expansive Identities, or SAGE, is the ACA's division for working with this population. If you are not a member of SAGE and you are interested in working with this community, I highly suggest that you join as either a professional or a student. They provide webinars monthly on working with these populations, and there is an upcoming conference in October that they are hosting in Chicago. So more opportunities for learning and engagement.
Okay. And we would like to close with the voices of the population that we've been talking about. I always like to utilize their voices because they're their experiences, right? So let me pull that up really quickly. Nope. I think I'm gonna have to share a different screen.
There is no audio playing
Oh.
on the video.
Uh-oh. Okay.
I think you just have to click share sound. Oh yeah, maybe it's in your headphones. There you go.
Okay, let's start that over.
Pause.
See me as you see your family member. See me as you see your newborn child. See me as you see yourself. Hopefully you see yourself in a good way.
Can't see the video.
In one word, how can cis people be more accomplices to the cause?
Dr. Robinson, I hate to interrupt. If you could just share your screen again.
Allow trans people to be whoever we want
Oh,
to
she can't hear us.
be. Completely
I'll try to get the chat.
Can't hear. Oh, you all still can't hear it? Oh my goodness.
We can hear, but we can't see it now. So you just need to share your screen again.
Okay, let's try this one more time. I promise.
We'll get there. It's fine.
All right.
You can see it.
Portis, be the backbone.
In one word, how can cis people be more accomplices to the cause?
Vocal, like being vocal where somebody else has misgendered you. Cis people won't correct them. They'll look to you to correct them, but trans people don't feel comfortable being like, hey, these are my pronouns like every single 5 minutes.
There are a lot of cis people who are inquisitive. They'll ask questions, but they don't take the time to realize how their words are going to affect other people. If they took that time, I think they would get a better understanding and realize that we're just people.
We all have dreams, goals, aspirations. We're just like you.
In one word, how can cis people be more accomplices to the cause?
Alliance does not mean you have to walk in the same path as me or completely understand my struggles and what I go through. It's about the respect.
See me as you see your family member. See me as you see your newborn child. See us as you see yourself. Hopefully you see yourself in a good way. But
How can cis people be more accomplices to the cause?
Education.
Education. I think there's so many resources for people to do their own research. It's kind of unacceptable to put trans people in the position to educate you about themselves.
so you want me to relive my trauma constantly to teach you, but will you really do or create the change that is needed to help protect me so I won't have to go through the trauma again?
In one word, how can cis people be more accomplices to the cause?
Unabashedly.
Be vocal. When you're around someone who's disrespecting trans people, you say something. When someone's misgendering someone, you say something. It makes people have to question themselves. You don't give them the privilege anymore to be disrespectful.
It's not just about not being transphobic, it's about being anti-transphobic. And that means you as a cis person educating the people around you, because trans people, LGBTQ plus can't be doing all the educating, they can't be doing all the work. So speak up.
Okay, so we're going to close there now, having heard their voices, and ask if there are any questions. I think we have about 6 minutes.
How would you recommend a clinician in training going about, talking to either their supervisor or other colleagues or other students in their program about any, biases that they might have that they didn't know about until they start working with the population? And then how can we, as their colleagues and as the people in the program, help support them so that way they don't feel ashamed for having those biases?
I would say if this is a student essentially that is wanting to explore their biases, right?
That is correct.
Okay. I would encourage them to reach out to maybe a faculty member that they have a relationship with, and explain what exactly it is they're needing. I know here at the Chicago School we have many ways in which we can support someone who is wanting to do that work. I would encourage them to one, validate the fact that they're even engaging in that critical dialogue within themselves that says, like, I need more support and more assistance. I believe any faculty member or supervisor would be willing to support a student who is in that position. So I would just say reach out essentially to their professors, to their supervisor, and say exactly what you just said. Like, I'm needing to explore my values, my biases in relation to the clients that I'm trying to support. And I believe within that, a lot of work can be done.
And encourage them to get involved in campus organizations. So here at the Chicago School, we have Pride Plus. I'm the doctoral advisor for that organization. So I'm, of course, going to advocate for it. So please come to our meetings. We have a wonderful time. But in those environments, we talk about how to challenge some of those values and biases that we have, and how to work with members of this community. We have guest speakers and things of that sort that can help with that. And then as a student, to support your colleagues and your fellow classmates, just recognizing that we all have had biases at some point in our academic journeys and our careers, and validating that it's great that you're recognizing this and seeking additional training and solutions to this and working on those biases.
Absolutely.
Great, thank you both.
Anything else in the last minute?
Absolutely. No shame in working on something. Y'all have work to do.
Well, thank you, Dr. Robinson. Thank you, Heather. We appreciate your time. If anyone does have questions or follow-up comments, please feel free to email the CMHC online email address, and I can direct them to Dr. Robinson and Heather. Otherwise, look for the email from Eventzilla with the link for the survey to receive your CE certificate. Thank you, everybody.
Thank you.
Thank you, everyone.